Greetings to
Hi.
all the viewers. Very happy Kanu is with me. She's like a younger sister to me.
Very
And
kind
she's
of
a
you, sir.
wonderful, wonderful human being. She's a very popular, famous lawyer. She's been in the army and now she's in the civil side. We operated upon her for thyroid cancer sometimes
Yes.
back, 3 years back?
Yes,
Three
December
years.
23.
So about 2.5, 3 years back.
Yes.
So well, आप बताइए थायराइड कैंसर क्या होता है and आपको क्या प्रॉब्लम थी and what all were your confusions and how did we all solve it and how have you been?
So, like for everybody, it was very unexpected. It was an incidental find. I had gone for my ENT checkup, and my ENT guy said that there's looking some swelling. You better get an ultrasound done. I got that neck ultrasound done, showed it to the doctor, and then he said there is looks something suspicious. Better to get a FNAC done. We got it done, and
You
voila.
got an FNAC done.
Yes.
People are very scared about getting an
No, it.
FNAC or a biopsy. They think that if it is cancer, it will spread.
No, I
Were
don't.
you also having such
No, no,
confusions?
nothing of that. So
Nothing of
because
that.
you had to identify what it is, right?
Naturally, so intellect, intelligent.
Yeah. So without the probe, it doesn't happen. And
Naturally.
it was ultrasound assisted. So it was
Okay.
very with precision.
Yes.
They knew where to pierce. They
Absolutely.
put the needle there itself, and it's called fine needle aspiration for a reason. It
Yes,
doesn't
so
even
this one chapter
yeah,
is over that
yeah.
FNAC से या biopsy से cancer नहीं फैलता.
नहीं फैलता बिल्कुल नहीं
Okay.
फैलता
Okay.
So when I got to know, I got the report in 2 days, and then it was diagnosed as PTC.
It was a thyroid cancer.
It was a thyroid cancer, and then of course it was like immediate surgery kar lo.
And must have been shocking, shaking.
Oh, it was. Nobody expects it. So the first thing was, how do I tell home? Yeah, that was a big thing. So before convincing others, I had to convince myself. So I took another consultation. I first test I did in Panchkula, and then I went. I work in Hyderabad, so I went there. I took a consult there with all those reports. They said yes. They said the same thing what Panchkula guys said. Full निकालना पड़ेगा, radiation देना पड़ेगा उसके पास.
Oh.
And I was like, no, 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 I don't want any radiation therapy. I'm very clear about it. So then I went back to my army colleagues, and then sir was referred to me in Mohali. So I landed up in Fortis Mohali. I remember I came here very scared and subdued, and I didn't know what to do. And he looked at me. He said, "The rarest of the rare is the best cancer if you want to have it." I said, "Wow, okay, that's a statement."
See, I tell everybody thyroid cancer. Suppose God asks which cancer, I have to give you a cancer, but which would you choose? You say, give me thyroid cancer.
How? मतलब
Thyroid cancer doesn't kill. Thyroid cancer, you can have a normal life if you get an optimum treatment.
yes, I agree.
Optimum
And
treatment. Now,
timely, of
what
course.
was the treatment confusions?
So confusion was the same, that it has to be followed by
The whole thyroid is to be removed
remove
necessarily.
one. Second, it had to follow
And
by
lymph nodes?
if impacted, yes.
Yes.
That was also a scare.
Yes.
And then they also told me that you have to follow through with radioiodine therapy,
Yes,
which
yes.
is a kind of
That's,
radiation.
That's one standard
Yes.
treatment.
Yes.
Remove the entire thyroid and all the nodes which look to be bad, and give a radioiodine thyroid,
Yeah.
radioiodine, whole body radioiodine.
Yes.
So that's one way of treating thyroid cancer.
Yeah, I didn't want it.
You didn't want.
I didn't
Okay.
want it. So I was very clear.
Okay.
And that's why I came looking for a third opinion. And I remember sitting here exactly at the same place, and he said, "What do you want?" I said, "I don't want radiation, and I want only the affected aspect to be removed. Is it possible?" He said, "क्यों नहीं? हो सकता है ना?" And then my second concern was scarring. He told me then, he said, "You will not even realize." I said, "Oh."
Can I make it? I don't know. I cannot make it. Where your
Oh, एक challenge चला है ना, art and artist. So this is art. He's the artist. But anyhow, sir.
So what did we do?
Well, I don't know what you did. You did some magic. I checked in to the hospital one fine morning on the prescribed date. We agreed on a date. Within a week, the date was given. We agreed on it, and I wheeled in at 5:30 in the morning, first surgery. When I woke up, I was like, okay, so there's something there. A bandage was there. That's it. I
And
never got any
your
blood
voice,
translation or anything. Nothing.
no blood
Yeah,
transfusions, are
nothing. That
never
was
required.
amazing. It was
They're never
nothing. Yeah,
required.
yeah.
And no pain.
Yeah, no, kind of no pain, yes. Oh, there was another scary factor, which everybody scared me that, while doing this surgery, your vocal cords might also
Vocal
get
cord.
impacted.
It is a very careful surgery. We give it all our care from our heart and with prayers, and with the with the practice of decades in this surgery, this complication never
नहीं
occurs.
सर मेरी आवाज
I
ऐसी
have
है.
never, I have never, I mean, God has been kind. I've never hurt a vocal cord nerve.
The
It's a
only
recurrent nerve.
respite my team, my family members got from this surgery was the 3 months I was on limited talking
No,
space.
but we wouldn't have stopped you.
Yeah, you didn't,
You
but
on your own thought of speaking
because
less.
it was said, ki, okay, give your vocal cords a bit
No,
rest.
we never
You
told
didn't,
you.
of course. I was like
You
taking
could have,
precautions.
been gossiping like we are now doing
Oh.
from the day one.
But that 3 month respite, I think, did good to them.
That
But my voice is the same. Or if I may say, it's better. I am. And one fun fact was when, of course, there's a lot of apprehension when you remove the bandage and all. When I came here for the checkup, follow up, and all, I was out in 2 days, and then I had to come for 10-day checkup, 5-day, or something like that, follow ups. And he told me, see, when he removed the bandage, he said, look, he made me look into the mirror. He said, this is a titanium necklace I've given you.
Titanium clips, and they absolutely look like a necklace.
They did.
So you
There were
don't really have to hide it.
25 or so. And really, even during that entire recovery process, I didn't have to wear a scarf or anything to hide it. It was December. High necks, of course, because it was December. But after that, I didn't feel conscious about it that, there's something. And over the years now, you can hardly make out.
So you see, for the education of people who are listening, thyroid cancer, if it is early and it's only one lobe involved, there are two ways of treating it. One is remove the total thyroid and give radioactive. The second is remove only that lobe which is affected and keep you under observation.
Yep.
And 10 to 20 years generally we have been following. I've been doing this surgery since the 80s.
Wow.
And none of my patients has ever had a recurrence in the other thyroid. It can have,
But
at
it's-
that
yeah.
time, if it happens, God forbid, at that time we can remove the second thyroid. There's no harm because this cancer does not kill.
Yes.
It is a good cancer. So if it does not kill, then why give you the morbidity and the side effects of removing the entire thyroid and giving you radioiodines if it is doable? I mean, not in every patient.
Yes.
Not that I don't remove.
Yeah, but-
there are patients
Of
where I
course.
remove the entire thyroid and I give them radioiodine. There are patients, particularly when the lymph nodes are involved, particularly when both the lobes are involved, particularly in elderly people. So there are conditions where we have to remove both lobes. But in your condition, you're a young lady, so I didn't want to harm you.
Agreed. And that is why that gave me comfort. And I was like, yes, this is the one.
And you're doing so well.
And we
And you
meet
live a
every
normal
6
life.
months now for such chit chats.
You will meet 6 months, every 6 months. And she's fine.
Okay.
So we really need to tailor the treatment according to individual, your personality, your age, and your stage of the disease.
Yes.
So you were early disease and you were young, and I didn't want to upset your life. And
And
you see,
thank you for
keep meeting
that.
me every 6 months just for cheering me up.
No,
Cheering me up.
no, a lot of gratitude, and I must say one more thing. It's been a pleasure. It was not a very easy time in my life at that point of time, and after a lot of one after the other, I was facing these obstacles. This was the last one, and your support, your team, everybody was perfect, and I'm recovered well.
Being what you are.
Thank you.
Thank you, Kanu.
Thank you.
Thank you, Kanu.
Thanks.